Hi everyone, it's Mr. Sinti, and today I'd like to talk to you about one of the great organs of the endocrine system of the human body, and that is the pancreas. The pancreas, as you can see in this picture right here, is a gland, and as it turns out, it's a gland that has dual functionality. It's both an exocrine gland, which secretes digestive enzymes and alkaline fluids into the upper part of the small intestine, and it's an endocrine gland, which is going to be the function of this video, which is a discussion of two of the most important hormones of the entire body, which is insulin and glucagon. And both of those hormones help to regulate blood sugar, in particular glucose. So they're regulating it, but they're antagonistic, meaning insulin is attempting to lower blood sugar and glucagon is raising it. And both of those are very important because we need to have the appropriate amount of glucose in our blood. And so as you may be aware, as if after you eat a meal, that's going to raise blood sugar levels and we're going to want to lower it. And in between meals, we're going to want to raise blood sugar level so that we have that. And so the pancreas, as you can see here, is both endocrine and exocrine. And so a little bit about the anatomy, a little bit about the location of the pancreas. The pancreas is sort of this feathery looking organ right here, and it releases, if you were to look inside of it, it has a common pancreatic duct. Okay, so this is a tube that is releasing pancreatic juices into this tube right here, which is the part of the alimentary canal. In other words, it's part of the digestive tract. So this is the first part of the small intestine. What you can't see right here is the stomach. And the reason that you can't see the stomach is that the pancreas is posterior to the stomach. And so if we had the stomach placed here, you wouldn't be able to see the pancreas. But here's the upper part of the stomach right here. So this is your pyloric sphincter, which regulates food entering into the duodenum, which is the upper part of the small intestine. Now, there's an interesting thoroughfare right here. This is the common bile duct, which is leading up to the liver right here, and that's bringing bile down into the duodenum as well. And so here you can see the liver, here's the pancreas, but the stomach is curiously not shown in this diagram, which would be right there. And so if you took the pancreas and you decided to slice it in half like this, you can see the duct right here. Here's the common duct, and then here's all these branching. Do you see these sort of connectors to the branching right here? These cells are part of the pancreas, which are part of the digestion. In other words, they're exocrine. These are the cells right here that are producing enzymes, which are specialized proteins which are going to aid in the digestion of food. And so it's totally appropriate that the pancreas is making digestive enzymes which are traveling down this duct into the intestine, which is helping to break down our food through hydrolysis. But do you notice here, these are like little pink areas. They're not literally pink, but they're in this diagram, they're pink. And do you see there's a blood vessel right there? And so these little cells right here, which are kind of like islands in the pancreas, are the endocrine cells. And as it turns out, these are the cells which are producing the two hormones that are important in our discussion of the endocrine system, which are glucagon and insulin. Yeah, and these little islands, and I'm not the first one to call them islands. As it turns out, they're literally called islets, which are little islands, islets of Langerhans. And so presumably this was the individual that first observed these little islands in the pancreas right here. And so here are the exocrine glands, which are producing digestive enzymes, and then here in purple are the little islets, and those are the ones that are producing insulin and glucagon. As you can see here, this is a nice diagram showing that the stomach is right there and the pancreas sits right behind it. And so digestive enzymes are entering into the intestine, but the insulin and glucagon are entering into the bloodstream, as you can see here. Let me see if I can animate that. And so here are the here are the hormones that are produced by the islets of Langerhans, such as insulin and glucagon, and that's going into the bloodstream. And so again, the exocrine gland are producing bicarbonate ions and digestive enzymes. So here's an actual light micrograph of the pancreas, and you can literally see how there's a little different. It's a little bit easier when it's highlighted here in yellow. But here are some of those islets right here, which are producing insulin and glucagon. And here's another picture here showing the islets of Langerhans. And these are the endocrine portions of the pancreas. And so what I want to say is a little bit about insulin now. And insulin is maybe if you were to ask someone walking down the street, can you name a hormone? They might say insulin. It perhaps is one of the more popular hormones of the body. And as it turns out, it's a protein, so it's non-steroid, and it's produced by beta cells of the islets of Langerhans. And whenever you have beta, it suggests that there's two kinds of cells. There's alpha cells and there's beta cells. So it's the beta cells that are producing this. And you might think, what's the story with getting into that level of detail? Well, as you may know, one of the problems with insulin is a disease or a disorder called diabetes, and so it's heavily studied, and so there is no detail when it comes to these kinds of matters. It's very serious. And so what does insulin do? Insulin lowers your blood sugar levels. That's what it's doing. Okay, so it's lowering it. And what does that do? Well, it's a protein that stimulates cells of the body to take up glucose. And in particular, all the cells take it in, of course, but in particular, glucose is taken in especially by the liver, and it's taken in especially by your muscle cells. And how is insulin regulated? Well, if your blood sugar is very high, then that's going to promote insulin to be produced. Okay, and this is what insulin really looks like. These are a chain of amino acids, so this is one polypeptide, and so insulin is two polypeptides, and so together it makes a protein. These are disulfide bridges which hold the two strands together. It's kind of interesting. And so let's talk a little bit about diabetes. And the clinical name for diabetes is actually diabetes mellitus. And some of the things that I want to mention that are most important, there's so much to know about diabetes, and I welcome you to, I hope this video is really just the beginning of this discussion, but as you may know, that diabetes has a heredity component to it, and so it's associated with your parents and grandparents, that sort of thing, and also being overweight, obesity plays a role in its development. And so one of the symptoms is that you have high blood sugar level, and that makes complete sense because if you're not producing insulin, now there's going to be two types of diabetes, so I'm just going to say this in general, but if you're not producing insulin, or if the cells are not receptive to the insulin, then you're going to have high blood sugar levels. So after a meal, you're not going to be able to lower your blood sugar level. And so how the body attempts to deal with that is that it tries to excrete it in the urine. Normally, the kidney's job in the body is to reabsorb glucose back into the bloodstream. And so you don't want to urinate out glucose. But when it's really, really high, the kidney can't handle that excessive amount of glucose, and so it's actually found in the urine. And you can detect this by using urine test strips. And so you can purchase those at drugstores. So some of the symptoms of having high blood sugar level are kind of predictable. So excessive urination, meaning that since it's very hypertonic, the blood, it's very difficult to reabsorb water back into the blood. And so therefore there's an increase in the urinary production. And so you're tending to have frequent urination and excessive thirst for the same reason. So the blood's a little high, and so you're losing a lot of water in your urine, and so therefore there's a quest for liquid. So these are symptoms of being diabetic. And also, if it's severe, what will happen is, since the cells aren't getting the glucose that they really need, even though the blood is really high, it's kind of ironic that there's so much blood sugar levels, but yet the cells themselves are starving of glucose. And so what will happen in a cell is a bit of a detail, but fat will substitute for glucose in these kinds of situations. And so what will happen is when you break down these fatty acids, I won't get into the biochemical detail of it, but a fatty acid can be acidic, and so you get these acidic metabolites, which then ultimately lower your blood sugar. Ultimately lower the pH of the blood, which then is life-threatening. So it's very serious. You may have heard of this before. Diabetes can be broken up into two types. So it's type 1 diabetes, type 2 diabetes. And so type 1 is what you commonly call insulin dependent, meaning that without insulin, a patient with type 1 diabetes won't live very long. And so how is this happening? Well, we believe that it's part of your immune system. It's an autoimmune disorder. So how about this? That your own white blood cells begin to attack the beta cells of the islets of Langerhans, and therefore interfere with their ability to produce insulin. So you're not actually even making it, or just very low levels of it, so it's not as effective. And usually this appears in childhood. And so this is kind of early onset kind of diabetes. So it's a childhood kind of thing. And so the treatment is daily injections of insulin. And so you have to inject insulin into the body so that you're able to regulate the blood sugar level. And I say injection because to take that insulin orally wouldn't be effective, because if you were to eat it, it goes into your stomach, and your stomach acid would actually break down the protein insulin, and it would lose its ability to function as an enzyme. So it has to be injected into the blood. Now, type 2 diabetes is non-insulin dependent, and it usually has to do with the fact that the cells of our body have a decreased responsiveness to insulin. So this is kind of brutal. So the body is actually producing insulin. Maybe it's producing a little bit less, but it's nevertheless, it's the cells, especially the liver and the muscles, are being unresponsive, and so they're not actually getting the message properly. And this usually occurs older in life, so above the age of 40 are usually, and so the risk factors are lack of exercise and being overweight, and so it accounts for about 90% of most individuals with diabetes usually can get this. And so you don't want to acquire this in your life. You might think, gee, I'm not diabetic, but you could possibly have it, because again, 90% of adults, not adults, but of diabetes cases will have this. I'll show you some stats in a moment. Actually, let's do that right now since we're talking about it. Let's just go right into that conversation. And so just want to show you here, just as a personal note, just to give you some visuals. Here's a student, and she looks like she's studying biology or physiology. And let's take a look at this.
Student is cramming for her biology test with only a frosting-covered donut for lunch. Specialized cells in her pancreas respond to the increasing amount of sugar in her blood by releasing insulin, a small protein that regulates blood sugar level.
So here you can see the protein insulin, which is being produced by the beta cells. So that's a beta cell in the islets of Langerhans. Now, what's interesting is what's all this out here. This is extracellular protein. And how does a protein get out of the cell? It had to be produced ultimately by the rough endoplasmic reticulum, and then the Golgi apparatus encloses it in a transport vesicle, and then it fuses with the plasma membrane and is released. But ultimately, insulin needs to then go into the bloodstream, because that's what we're talking about, is an endocrine gland that goes into the bloodstream. And so take a look at this. Okay, so how about if, for example, we look at blood sugar level over here, glucose sugar levels. This is milligrams per 100 milliliter. Okay, so it's interesting. Individuals with diabetes have a pretty good sense of because they monitor their blood sugar levels. There's a device that you could prick your finger, and it will actually read the amount of blood glucose that you have, and so you have to check it to make sure that you have the appropriate amount. And so if your blood sugar is a little high, you might want to take insulin, that sort of thing. And here's the insulin level here in red. Let's see what happens here. So say you have a meal that has a high amount of carbohydrate in it, like that young woman who was eating that donut. And so what happens is there's a big spike of glucose into the blood, and so the pancreas responds. The pancreas will produce as a result of high blood sugar level, it'll produce insulin. I'm sorry, it'll start to lower the amount of blood sugar that's in your bloodstream. As you can see here, it's going down like this, like that. Okay. So what's happening here is, I may have misspoke. So here's a high amount of carbohydrate that's coming in, and then here's the blood sugar level right here. So it's going down as a result of insulin production. So this is normal. This is what happens in most individuals after they eat a meal. And so here's type 1 diabetes. So what would happen here is you eat a meal and your blood sugar level goes up after the meal, but it's not going down. And it's like, hey, there's no insulin production. And so this would be threatening to the body if left untreated. Now, when you treat it, now what are you treating it with? You're treating it with an injection. So this is not from the body. This is exogenous. In other words, you're taking a shot of insulin. And as the insulin goes up like this, it's going to lower the blood sugar level down pretty much like a normal individual would. And so you could regulate it by taking a shot of insulin. And you can see, so everything's fine, provided you take that shot. Now, what's interesting in type 2 diabetes is it's curious. So after a meal, your blood sugar levels go up. Check this out. And what's interesting is type 2 individuals are producing insulin, but yet the blood sugar level isn't going down. So this is odd. So if this is the case, it isn't so much of a problem of the pancreas as it is a problem with cells responding. In other words, the target cells don't take up insulin. Right there, and so that's type 2. And then, but if you treat it, there are some medications that you can take to allow cells to be more responsive. And so fortunately, we have a couple of medications that doctors can prescribe that will have the effect of lowering your blood sugar levels because it makes the cells a little bit more receptive. So that's kind of interesting. And so, this is a little depressing, but I think the facts are important. If you were to do a search on, here's some data from 2011 about the National Diabetes Fact Sheet, and the numbers are always changing, and so it's a dynamic discussion. But just for a point to discuss this, and so take a look at this: 25.8 million children and adults in the United States. That's 8.3% of the population have diabetes. Were you aware of that? That's a staggering number. So we're talking approximately 10% of Americans have diabetes. Okay, and so to me that seems like a high number. And so we're talking about, these are the ones that are diagnosed right here. These are undiagnosed, and these are almost pre-diabetes. In other words, like likely to occur if things continue to go this way. Now, if you look at these numbers, 1 in every 400 children and adolescents has diabetes. That's kind of a high number too. And then again, look at these numbers over here just to jump out. Age 65 and older, approximately 27% of all people in this age group have diabetes. So approximately 30% of individuals who are over 65 have diabetes. This is a very serious thing. It seems to be even in terms of gender, males and females. And there is a little bit of an association with race. And that's kind of an interesting thing too. And so, some of the complications can result from high blood sugar is having heart disease or stroke. You have high blood pressure as a result of it. Blindness can result, again, these are untreated. Kidney disease, a lot of individuals that have kidney problems are the result of untreated diabetes. And you can have nervous system disorders, etc., and then ultimately amputation if that's an issue. The cost of it is staggering. And so we're talking about billions and billions of dollars, hundreds of billions of dollars that the medical profession needs to employ in terms of treating diabetes. So this is a major, major situation. And so let's get back into that. So I just wanted to keep you abreast of the situation that we're talking about, something that is not a minor disease. Diabetes is a major disease. So the other hormone that never gets the love, it's always sort of like the twins. One's getting all the attention, the other one's not getting any attention. Just as important as insulin to lower your blood sugar levels. When blood sugar levels are low and you need to raise your blood sugar level, that's when the alpha cells of the islets of Langerhans come in. Langerhans. They produce the hormone glucagon. And glucagon is produced by the pancreas, and it raises blood sugar level. And so where's the glucose coming from? It's like, well, I haven't had a meal. I don't have any glucose. Where's it coming from? Well, we store glucose in our liver. This is a polysaccharide called glycogen. It's a very branched version of starch. And so it's kind of sometimes called animal starch. If you feel more comfortable with that, we have animal starch in our liver and in our muscles. But it's really called glycogen. And what happens is this hormone glucagon triggers the liver and muscle to release those stores into the blood. And so, again, here's a picture of the liver, this gallbladder there. And so liver and muscles are the ones that are releasing glucose into the bloodstream. And so, in summary, you've got these two hormones, which are insulin and you've got glucagon, and they're sort of like a teeter-totter, sort of trying to balance through negative feedback and being antagonistic with one another our blood sugar levels. And all this is happening sort of unconsciously. It's just incredible. So again, after a meal, insulin is being produced. It allows cells to be more receptive to taking in glucose, and so therefore it lowers blood sugar levels. And then the stimulus is that there's a lot of glucose in the blood, and so it lowers it. But if the blood is really low, you want to raise blood sugar levels, and so the alpha cells produce glucagon, and that causes glycogen to be broken down in the liver and the muscle, which raises blood sugar levels. And so this is how it works. So I hope you enjoyed this video look at the pancreas, one of the crucial glands of the endocrine system, and it produces those two really important hormones, insulin and glucagon. Hope you enjoyed it, and thanks for watching.